Is hip pain making it hard for you to walk, climb upstairs, or even a simple task as putting on your pants? I hate to break it to you, but stretching alone and resting your hip pain won't fix it. In fact, it will only make it worse. May adlaw na tong tanan. I'm Nathan, I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. So here's what nobody tells you is that hip pain after the age of 60 comes from weakness and poor pelvic stability. It is not just from stiffness, it's not about rigidity. If you only stretch, then you stay unstable, and instability is what keeps your hips hurting. So one of my patients, let's call her Ivy, and she was about 70 years old when she came to me. She told me that she don't like getting up from mornings or upon waking up, not because she's tired or she don't like Mondays like most of us, but because putting on her pants or even her jeans, especially her jeans, is so difficult. She experiences a lot of pain, and it's even very sharp, and sometimes the whole day it's dull. And this is because of her instability, and she has poor pelvic control over her hips and all the muscles around that area. And so I gave her a series of exercises that she can do at home. And if you want to find out what those exercises are, just follow along with me. All right, so we are going to start on our bed. You don't have to buy a bed like this. You can use your own bed or even the couch. You can also be on the floor. Just safely go on your floor very slowly, all right? So we're going to lie flat on our backs with our knees bent, okay? And this is what you call the pull and pushing of our thighs. This will retrain our sacroiliac joint or the back part of our hips to become stable. It will reduce the give. It will make our pelvis and hips more steady, okay? So you're just going to grab the backs of our thighs like this, and you're going to just pull. So we're stretching, generally stretching here first, and then you're going to push away. So your leg is going to push away while your arms are still pulling back like this. So your leg will not move. So the first part again is going to be pulling, bringing your knees towards your chest, and you're going to be pushing away for about 15 counts, all right? So let's start. We're going to pull for about 6 seconds. 1, 2, 3, 4, 5, 6, and then push away for about 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So try to do one side 3 times, so 3 sets. Let's go with our left. We're going to again pull for about 6 counts. 1, 2, 3, 4, 5, 6. Your leg pushing away while your arms are pulling back. That way it will have a pull and push, right? So you're going to really push away with your leg and then count 15 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Try doing this exercise again 3 times before getting up from the bed. Or you can also do this throughout the day, okay? So next one, we are going to retrain our hip flexors. So let's do a lying down marching in place like this. Very easy, right? This will retrain your muscles that brings your knees up when you are walking or climbing upstairs, right? Let's do 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now, in order to bring that to the next level, making it harder, if that got very easy, you're going to slightly straighten your legs out like this. And even if you are really stronger already, make it down, all the way down. Bring your feet all the way down like that. And you're going to just lift the entire leg without really bending your knees much, and alternating, just touching the bed with your heels. All right? And this will really retrain your hip flexors. Let's do 10. 1, 2, 3, 4. I can feel it now. 5, 6, 7, 8, 9, 10. All right? And that is your marching in place while still in bed. Right now we're sitting up. So we are going to do the seated hip rotations. So you can do this at the side of your bed or anywhere else where you are sitting more upright, even your couch, your regular chair, or if you're still working at the office. So we need to also mobilize our hip joint. So we're going to just refer to our knees. We're going to just make sure that we are imagining that our knee is drawing a circle like this, all right? Going up and going out, down, up, and circles, all right? Let's do 10 on each side. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And that is your right side. Let's do the left. All right, so make sure that you are also trying to draw a big circle. Do not move your foot. Again, your reference point is your knee, all right? Let's do 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And that is your hip rotations. For the last exercise, all you need is a belt, a regular belt. Just wrap it around your thighs, closest to your knees. And make sure that your knees are not going to be touching like this. Make sure that they're going to point out away, all right? So this will make sure that we are going to engage our glutes, your butt muscles, which are really strong hip stabilizers. And those muscles are also responsible for proper walking, proper stair climbing, where your knees and your lower back won't be taking all the hit, taking all the load. It should be the butt muscles, all right? So again, try to get you a belt, loop it around your thighs closest to your knees. We're going to do the belted sit to stand, okay? This will really engage our butt muscles. Let's go up like this, all the way up, making sure that those belt loops won't fall down to your ankles, right? And then slowly sit back down. Let's do 10. 1, 2, I know this is difficult. You can go slow. 3, 4, ooh, I can feel that now. 5, squeeze those glutes. 6, 7, 8, 9, woo, 10. Try to do this 3 sets, but rest in between. Again, it is also important to have those rest breaks when you're doing some exercises. And that was your belted sit to stands. If you got to this part of the video, congratulations, you have finished the exercises, the series. Which brings me to the attendance check. Type down the word hips in the comment section. Again, the word is hips. This will make sure that you are following along with me and not just watching. Which, let's bring back Ivy, my patient. You remember? She faithfully did those exercises I just showed you. And at first, she was just lying on her bed doing the push and pull with the thigh, right? And then she sat up and did the marches. And finally, she did the sit to stand with the belt loop around her thighs, close to her knees. And a few weeks later, she smiled and told me, I might not need you anymore because she's able to finally put on her pants, especially her jeans, without any stabbing pain or aching pain during the entire day. But here's what surprised her the most. Her low back and even her knees also stopped hurting. Why, you might ask? It is because when the hip stabilizing muscles are working and they are finally waking up, they take the pressure off the back and the knees and even your entire body, because those joints carry all the strain if the hips don't work. If the hips start working, then those joints and areas will stop feeling bad as well. So, if you know somebody who might benefit from this video, please share this to them. If you have elderly parents or if your grandparents are constantly hurting, please share this video to them. So, if hip pain is slowing you down, don't just stretch, train stability, train the control of your hips, and you'll move the way you want to move again. And just a reminder, consistency is the key and never give up. Until next time, paalam, zoom!